Now, what is cataract? What is monofocal? What is multifocal? What is extended depth of focus lens? What can go wrong in a cataract surgery? Well, commonly, as you grow older, the chances of getting cataract is higher. Hi, I'm Dr. Chinmaya Sahu, director at Sahu Eye Hospital. Now, let's go into a new series. This series is on cataract, and we'll address each and every small aspect of it. Now, what is cataract? Now, inside your eye, if you look, there is a lens out here, and the job of the lens is to focus the outside light on the back part of the eye called the retina. In simple language, if the cataract starts turning opaque or starts turning white, it is called cataract. Now, what are the types of cataract? If the periphery of your lens is becoming white, it is called cortical cataract. If the back surface of your lens is becoming white, it is called posterior subcapsular cataract. The entire lens has become white, it's called mature cataract. There's another type of cataract called nuclear sclerosis, where the lens starts hardening and the color starts changing. So these are the different type of cataracts. Again, cataract can be because of various causes. So what causes a cataract? Diet. If a diet is not healthy and we are having a lot of fatty food, a lot of oily food, that is one risk factor. If there's a lot of ultraviolet light exposure, that can also lead to cataract. Ultraviolet light exposure can be from the sun, can be from the mobile. Third, if you are diabetic and your sugars are not under control, then the high blood sugar can also cause cataract. So cataract can also occur because of various other reasons. If you have some kind of disease for which you are taking steroid medication, that can also cause a cataract. Cataract can also happen in congenital cases. Now, if you have a cataract, what are the symptoms of cataract? The first symptom will be finding it a little difficult to see clearly. You may feel that what you could earlier see clearly is no longer the same. Second is the lights start bothering, especially when you go out, the headlight of the car starts spreading and they start causing a problem. Third, we start making mistake in identifying colors. Fourth, at times you can have double vision. Patients complain of seeing a shadow or a double vision. Fifth, overall decrease in the brightness, sharpness of what you see. So these are the symptoms of cataract. At what age do we generally get cataract? Well, commonly, as you grow older, the chances of getting cataract is higher. But we are finding that with modern lifestyles, we are getting cataract at even younger ages. You can be even getting a cataract by birth for various reasons. So it's not that cataract only comes with old age, it can come at any age. Does every cataract need to be operated? Well, not really. If you have a cataract and you are able to manage with it, it's up to you. But earlier when we used to do a cataract surgery, we would open up the eye almost 180 degree, pull the lens out, take stitches. So the older saying was wait for the cataract to become ripe or mature. In the modern system, we use phacoemulsification. We enter the eye through micro incisions. We don't even inject the eye, we just operate under drops. It happens in generally 5 to 6 minutes. And at the end of the surgery, there is no patch also. You just put on a glass and you walk out. There are amazing lenses which can ensure that you even get free of your glasses. And because of these advancements, nowadays, what we say is if you have a cataract and you're facing an issue, you can do it at any time. Sometimes people even do it to get rid of their glasses. Now, what are the various lenses that can be implanted in the eye during cataract surgery? Now, out here I have a box. If you see, this shows a natural lens which is transparent. Now, when we are going to implant a lens, once you've implanted the lens inside the eye, basically you're going to fix the lens in this particular bag. Now Broadly speaking, there are three groups of lens: monofocal lens, extended depth of focus lens, and multifocal lens. Now in a monofocal lens, if you see this particular lens is a monofocal lens. It is transparent, it has no color to it. So in monofocal lenses, you have features: hydrophilic lens or hydrophobic. In a hydrophilic lens, the chance of a layer forming behind the lens is a little more. Non-aspheric lens and aspheric. In a non-aspheric lens, sometimes you can have issues like light spreading and other things. And the third is a non-yellow tinted or a yellow tinted lens. Now a yellow tinted lens basically blocks the blue light or the ultraviolet light and is useful in situations where you have a retina problem, or you want ultraviolet light to not go to the retina. Well, some doctors can even say otherwise. They can say that a blue light is going to block the yellow lens is going to block blue light and thereby decrease the brightness of what you see. But what is generally believed is blue light blocking is protective for your retina, so a yellow lens actually works well for you. Now, if you are looking at number correction, then the doctor might talk to you about a lens which has rings. Now this is called a multifocal lens. In a multifocal lens, the entry level multifocals are called bifocals, where your far vision and near vision becomes clear. In a trifocal lens, your far, intermediate and near become clear. Also, the trifocal lens causes less glare compared to a bifocal lens. What I mean by glare is the light spreading that happens especially when you go out at night, when you're driving on a highway where it's pitch dark. So that glare is much less with a trifocal. The third category, the extended depth of focus, basically stretches the light beam, gives you good far vision, intermediate vision, but for near you may still need a glass. If you go for a extended monovision lens, around 1.5 number might be required. If you're going for a true extended depth of focus lens, then to a large extent you may be without glasses. It's only when you are doing a lot of focus reading you may feel that a +1 number is required. So we have looked at what is monofocal, what is multifocal, what is extended depth of focus lens. Now, whenever we decide on the lens, we do a test called biometry, where we are measuring the lens. Now, most of the time, the power of the lens depends on the length of the eyeball, but it also depends on the curvature. If the vertical and the horizontal axis of your eye are not close to each other, then you may land up with a cylindrical power, and to correct that, then you need toric lenses. In other words, let's imagine there's a ready-made lens which can correct your power, or you have a toric lens which is a customized lens which may be required at times. Now, to quickly kind of recapitulate, monofocal lenses give clear distance vision. For near, you will need a +2.5 number. Multifocal lenses give either clear far and near or clear far, intermediate and near. You won't need numbers for reading, but at times the light can cause a glare. Extended depth of focus lens gives good far and intermediate, and for near you may need between 1 to 1.5. Now, are we all good candidates for multifocal lenses? Well, a monofocal lens can be done in any kind of situation, but for multifocal lenses, ideally it is important that your retina and your nerve should be fine. If you have a lot of nighttime driving, especially on the highway where the pupil dilates, then again it's better to avoid a multifocal lens. Lastly, if you have a nature which is anxious, what we call as a type A personality, then again it is better you avoid multifocal lenses. Should all diabetics not do multifocal lenses? No. If you have diabetes and your retina has started getting affected, especially if there is swelling or there is bleeding into the eye, yes, you should not do a multifocal lens. But if you have mild diabetic changes in the retina, but no swelling and no bleeding, and you're likely to keep a good control of your sugars, then you can go ahead with a multifocal lens. But where you are in doubt, it is safer to err on the side of an extended depth of focus lens or a monofocal lens. What about if I have undergone number correction surgery? If I've undergone LASIK in the past, if I've undergone RK in the past, am I still a good candidate for these lenses? Well, this is a very controversial topic. There's no one size fits all answer for this. Whenever you are post a refractive procedure, we evaluate a lot of things. We do a corneal topography, we look at the surface of the eye, whether you have dry eyes, we look at higher order aberrations, we look at the amount your pupil is dilating, what kind of machine are we using to do the lens measurement, do we have access to the best machine, what kind of formula are we going to use to calculate the lens power. So with the modern premium lenses, you can do them post a cataract surgery, if it's post-refractive surgery. But you have to be sure that you're discussing with your doctor in details or in depth regarding all these situations. What can go wrong in a cataract surgery? Well, at times there are certain problems that can happen during the surgery. One such problem is where the capsule which holds the lens ruptures and the lens goes behind. And this generally should be able to be managed well by the doctor, but if not, the doctor may refer you to a retina specialist. Out here, since I am the retina surgeon, if God forbid such a situation arises, we take care of this. The second is the risk of infection. Any surgery carries a 1 in 1000 risk of infection. As I told you, if you have a state-of-the-art OT which is using which is a modular OT having HEPA filters, and if you're taking proper precautions, the risk goes down. However, that has to be kept in mind.